As somebody who works primarily in the men's health space, I am confronted with this decision-making problem more often than not, and it's difficult to keep track of all the new HIV meds, but I just wanted to share a few points just to provide medical education and information. This is not medical advice. This is something you need to discuss with your prescribing provider if this pertains to you. If you are a clinician who works in this space and wanted a little bit of information, let's dive right into this. And so I'm going to share a variety of drugs and just basically give you some information about how they work and don't work. So the first drug, and these are in alphabetical order, is Amprenavir, and it's not well studied, but it's felt that it probably does increase the effects of sildenafil, which can be manifested as hypotension and priapism. So basically low blood pressure and prolonged painful erection for those that are looking at this from a non-clinician perspective. And then let's jump on to the next one here. These are oftentimes challenging to say, but Agenerase, and in terms of this drug, it has really not a lot of data on it, but it's felt also to potentially increase the sildenafil levels, and it is best initiated at a lower dose and separated by at least 48 hours between uses of sildenafil, is what the manufacturer is stating. Next drug is Darunavir, and basically sildenafil effects are increased, probably maybe delaying the concentration peak by about 38%. So again, starting at the lower dose and separating by about 48 hours. Cobicistat, I think I spelled that wrong. That's Genvoya. Actually, this is one of the more common ones that I encounter, and this definitely has some impact on dosing and safety. And so in general, maximum dose between sildenafil versus Viagra is between 20 and 25 milligrams, and no more often than every 48 hours. Again, because of the potential increased risk of low blood pressure and prolonged painful erection. That's the main limitation there. Darunavir, again, also similar to the preceding ones, again, where it's going to increase the hypotensive effects, and same initiating information for this as well. Moving on to Amprenavir. It's interesting that some of these drugs are being studied in light of the current COVID outbreak, but these drugs will increase the level of sildenafil, particularly when administered with boosted protease inhibitors. And this, again, also limits the starting dose and the frequency of how often they can be redosed in terms of the ED medications. So Intelens, this actually decreases sildenafil effects. We generally don't adjust the dose in this setting, but it can delay the concentration and peak of sildenafil itself. Crixivan, older drug, interesting. This can also cause kidney stones. I see that a fair amount in my previous life as an ER physician. But this also, again, increases sildenafil effects. It blocks the metabolism of it, and it can greatly increase the levels by about 300%. So again, the same limiting initiating dose and readministration dose of sildenafil is recommended by the manufacturer. Kaletra, again, this is a little bit of an older drug. It's not well studied in terms of sildenafil use, but it's felt that it could increase levels, and felt lower dose should be started, and again, space it out a little bit just for safety. Viracep, again, not well studied, but what data are out there show that this does increase sildenafil levels as well, which potentiates the risk of low blood pressure and priapism. Let's see. Ederant, really no significant change noted, and the manufacturer's not noting any dose adjustment necessary for that. Ritonavir, again, going to increase the effects due to P450 metabolism mechanism, and again, this is going to increase levels potentially by up to 1,000% of sildenafil, the area under the curve. So this is a significant interaction as well that should be noted. Sequinavir, or Agenerase. This similar mechanism can increase sildenafil levels under the curve by about 210%, and not only the increased risk for blood pressure issues, but potentially also some flushing, headache, the other things that go along as common sildenafil or Viagra or generic Viagra side effects. The take-home point here is discuss this with your prescribing doctor if you're a patient watching this. It's really complicated to know all the interactions. This presentation just dealt with a single HIV drug. Obviously, there's other issues like blood pressure, diabetes, gout, inflammatory disease, chronic pain. All these things factor into the decision-making matrix regarding the safety, duration, dosing, and drug choice when presented with a patient looking for some help with erectile dysfunction. Hope you found that helpful. Let me know if you have any questions.